Hi, I'm Carly Lewis, and I'm going to be the nurse taking care of Francis Mishu today. The patient's MRN is 404929. He is 81 years old, and today is his birthday, so his date of birth would be 4/28/1939. He has no known allergies. Mr. Mishu was admitted to the USM hospital with a small bowel obstruction. He has NPO and has an NG tube in place on low intermittent suction. Over the past 4 hours, Mr. Mishu's NG tube has put out 600 milliliters of dark bilious fluid. His serum potassium level is 3.2 MEQs per liter. The patient's serum potassium is low, and we like the range to be within 3.5 to 5 MEQs per liter. He does have a peripheral IV in place. The patient's maintenance fluid is 1,000 milliliters of D5 half normal saline IV, 90 milliliters per hour continuous. I'm just going to check that against the MAR, and that's correct. His fluid intake for the day would be 2.2 liters of fluid, and that is adequate because we like the daily intake of fluid to be 2 to 3 liters. The patient is not receiving any potassium in his maintenance order, and his sodium is 169 MEQs, which is adequate because we like it to be over 100. I would call the provider about his maintenance fluid because the patient is not receiving any potassium in his order. The patient is NPO and has a low serum potassium, and this could cause hypokalemia and could put the patient at risk for cardiac issues. Looking at the replacement order, I see that it's 1,000 milliliters of D5 half normal saline with 20 MEQs of potassium IV for NG replacement 1 milliliter every 4 hours. I'm just going to check that against the MAR, and that is correct. The fluid replacement would be 600 milliliters by 4 hours, which would give you 150 milliliters per hour. The potassium is 72 MEQs, which is adequate because we like it to be between 40 and 80. And then the sodium is 277 MEQs, which is adequate because we like it to be over 100. I believe the patient is receiving the right solution because the normal saline is replacing the acid in the body that he is losing. Also because the patient is NPO and the fluid is providing intravascular stability. The solution is okay for this patient because he is hypokalemic. The patient is receiving an adequate daily amount of IV maintenance fluid. However, the patient is not receiving potassium in his maintenance order, but he is receiving it in his replacement order. So he is receiving an adequate amount in the replacement order, but not the maintenance order. I'm now going to go in and see my patient. And now I'll be entering the patient's room. Knock, knock. Hi, Mr. Mishu. I'm Carly. I'm going to be your nurse taking care of you today.
Okay.
I'm just going to wash my hands really quick. Washing my hands. Can I please get your name and date of birth?
Francis Mouchard, 4/28/1939.
All right. And can I please get, I'm just going to check your MRN. So 404929, 404929 matches with the MAR. I'm just going to put some hand sanitizer on. And I'm going to make sure the orders match the IV. So 1,000 milliliters D5 half normal saline IV, 90 milliliters per hour. Matches, and then 100 milliliters D5 half normal saline, 20 MEQs of potassium IV at 150 milliliters per hour, and that matches. All right. So today we're going to give you maintenance and replacement fluid because you have low potassium and you lost 600 milliliters of fluid, so we need to replace that. How are you feeling?
Fine.
And is it okay if I assess your IV?
Sure.
Alright, I got my gloves on. There's no redness, no swelling, no phlebitis or infiltration. It's not warm or hot to the touch. Is there any pain? No. So now I'm going to check the pump rate. So line A should be the maintenance fluid, and that will be 90 milliliters per hour, and the volume to be infused will be, I'm going to set it at 995 because I don't want the line to run dry. And then line B will be infused at 150 milliliters per hour, and the volume to be infused will be 600, and that's correct. Goes against my orders. So now I'm going to scrub the hub of the IV with alcohol. And I'm going to flush the IV. Flushing the IV, and that feels okay, doesn't hurt at all. And I can feel it returning to the vein, so it's flushing well. Alright, the IV has been flushed. And now I'm going to hook up the IV. So I'm going to scrub the hub of this. I'm going to put the IV in. And I'm going to start the pump. So now we're running the maintenance of 1,000 milliliters D5 half normal saline at 90 milliliters per hour continuous. And the volume to be infused is 1,000, but we're infusing 995 so we don't run the pump dry. And then for the replacement, we're infusing 150 milliliters per hour, and we're doing 600 milliliters to be infused for the volume to be infused because she lost 600. And we're also going to call the doctor to see if they can add potassium because she does have a low serum potassium and there's no potassium in the maintenance. And now I'm going to put the bed in the lowest position. Perfect. And here's your call bell. Is there anything I can do for you right now? Do you have any questions?
No, I don't think so.
All right. If you need anything or anything feels off, just give us a call right here on your call bell, okay?
Okay, thank you.
You're welcome. I'm just going to dispose of my gloves and my flush and my alcohol properly. And I'll be back to check on you in about 30 minutes.
Okay, thank you.
You're welcome.